Hello, I'm Dr. Jyoti Shetty, Professor and Head, Department of Psychiatry at the Bharati Vidyapeeth, University Medical College and the Bharati Hospital Research Center, Pune. When we are talking about maternal mental health, a few myths that are there. It's assumed that a new mother will be very happy, will be very joyful. Becoming a parent is something that is instinctive, natural, but this is not so. A lot of new mothers experience a lot of anxiety, even depression during either pregnancy or following the delivery in the postpartum period. When we are talking about maternal mental health, it is assumed that the mother will bond with the child. We all wish for the mother to bond with the child, be happy, so that improves the child's growth. The activities of the child is something that can happen faster because the interaction with the mother is so good. But when a mother is experiencing severe anxiety, severe depression, all this gets impacted. The bonding gets impacted. In fact, what we know is when a mother, a pregnant woman, is anxious, has significant anxiety and depression in pregnancy, the growth of the fetus or the baby inside could be affected. This impacts probably the delivery, which could be complicated, the future growth of the new baby in terms of its activity, its cognitive level may be impacted. So it is important to address these maternal mental health issues early and see that they're treated. We all know and we all have seen that advice for nutrition, getting a good sleep, getting enough rest, having a very good social support ensures that the mother has a very good pregnancy, uneventful, has a good postpartum period where there is healthy growth for the child and there's a healthy mental state for the mother. But it's also known that when there are certain risk factors, like whether it is poverty, whether it's a migrant working woman, whether there's a psychosocial stressors, when there is domestic violence, this may affect the pregnant lady. This affects the new mother and can impact her mental health and in turn impact the child. It is seen that 15% of pregnant women and almost 20% after delivery may experience significant mental health issues, namely depression and anxiety. In fact, it's known that 1 in 5 women may experience mental health issues in pregnancy and after delivery. What do we do about it? What is important is to understand what is significant depression. Significant severe depression can also lead to self-harm and sometimes the woman may die by suicide. It's known that there's a high chance if a woman is severely depressed. When we understand by depression, all new mothers may experience some amount of poor sleep, not getting rest, feeling very fatigued, very tired, probably because of the child waking up and sleeping at different times. It can impact the mother's mental and physical activity also. The mother may go through what is known as baby blues. Almost 50 to 85% of women may experience this. This is something that's mild, may resolve on its own with a little bit of care, with a little bit of psychosocial support, even maybe counseling. But some mothers may experience something that's more than that. They may experience depression, which may be severe. It's more than just stress. The mother or the woman who's pregnant may have persistent, continuous sad mood, not feeling interested in anything, may get very poor sleep, may feel very unhappy, may feel very untired, may even get suicidal thoughts of harming herself or child. And this is something that needs to be addressed. This needs to be addressed by a mental health professional, by a psychiatrist. There's another myth that psychiatric medications are harmful for a pregnant woman, or even when the mother is lactating, breastfeeding. But there are lots of safe psychiatric medication that can be used, that are known to be used, and it is important to address depression and anxiety in pregnancy and lactation period, because it affects, as I said, the child's growth both in the uterus and after it's born. So it is important to address the mother's depression and anxiety integrated with general health care of the young woman. This is something that needs to be sensitized to all around, including the family, the caregivers, even the health workers who are taking care of the woman. Because when something like this, when mental health care in the woman is not good, when maternal mental health care gets affected, it affects the baby, it affects the mother, it affects the families and society in general. So we all need to be sensitive for ensuring that there is good maternal mental health care for the sake of the benefit of the child, of the children, of the families and of the society. So we as healthcare professionals, whichever discipline we come from, need to be sensitive to this and also need to educate both our patients and their caregivers and society at large about this. Thank you.